So he'll try and answer some of those on there as well after we do this segment on TV. That's the most important. Okay, so a male Yorkie, Oliver. When I pick him up, sometimes he yelps. I only notice it when he has to go pee, and it's on his tummy under his ribs.
So I think that if a patient or if one of your pets is consistently painful, that's definitely a reason to go bring him in to see your family vet and get examined. Smaller dogs can sometimes get stones in their bladders, and this can be something that can cause recurrent pain. They can also get infections in their bladders that can predispose them to stones. So a lot of times, especially if this is an older dog, I'll recommend regular urine screening to make sure that they don't have any crystals in their urine, which will predispose them to stones.
Okay, one of the other things, some people don't know that they can give their dogs like people medication, but different doses based on how much the dog weighs.
Yeah, but if a pet's painful, I think that you should definitely be consulting your veterinarian before giving any.
If they're yelping,
medication.
that's a bad sign.
Yeah, if they're uncomfortable and it's consistent, I definitely would say contacting your veterinarian. And having a good relationship with your veterinarian is important too. That's why we recommend coming in on an annual basis for these exams. You know, my clients, they'll often call. I'll call them back within the next 24 hours, and I'll let them know if it's something that they should definitely be coming in for an exam for, or if it's something maybe there is a home remedy for. I'm more than happy to recommend that. But definitely having that relationship with your veterinarian and reestablishing that on an annual basis is an important thing.
Okay, also our dog has a huge lick wound. He won't leave it alone. They put a cone on him, but he's able to remove the cone, and he's had it for a couple of years and doesn't seem to think it's a problem.
Oftentimes you'll see these, we often call them hot spots or lick granulomas. Sometimes they'll be over the wrists or over the elbows. In those situations, I get concerned sometimes that could be due to pain from arthritis.
Okay.
So that can be a cause for that. Sometimes there could be something under the skin, like a draining tract from some sort of foxtail or something like that. So that's also something to rule out. Sometimes allergies can cause hot spots as well. In really bad situations, sometimes I actually have to remove this infected tissue if antibiotics and anti-inflammatories aren't clearing it, and I have to surgically remove that tissue because they can be a cause for recurrent infection.
Okay, I should mention too, Dr. Sam is on Instagram. Dr. Sam Varon, is that right? V-A-R-O-N?
Yeah, Dr. Sam Varon.
Yeah, you can find him there, and if you have questions, make sure you follow him on Instagram. Talk to him on there. We'll keep you posted on Facebook Live during the commercial break. But before that, planning your wedding day, but not sure where to start. One spot has got it all. Coming up after the break, we're live from the Ultimate Bridal Show.